The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
Better eyes for a better life. Good evening, viewers. Welcome to today's episode of KIMSHEALTH Doctor Live to promote a healthy lifestyle with us. Myself, Marina Francis. We know that proper care for the eyes is an essential part of our overall health and well-being. So in today's episode, we are going to have a discussion on what is the proper way of taking care of our eyes and what are the common eye problems that we may face and how we can prevent them. So joining with us in today's episode is a specialist ophthalmologist with over 9 years of experience, Dr. Rajiv Krishnappa. He has completed his MBBS and MS in ophthalmology from Bangalore Medical College. He also has an expertise in phaco surgeries. He is currently working at KIMSHEALTH Medical Center, Mohrak branch. So let us move ahead with today's discussion. Good evening, doctor. Welcome to the show.
Thank you.
Thank you for joining with us today.
My pleasure.
Doctor, we shall begin with the discussion. So I would like to begin with children. So this is a common query for the parents. When should children get their eyes checked?
This is usually done by the attending pediatrician. especially when the child is born in a hospital. Most of the childbirths happen in the hospital these days. So the attending pediatrician will take a look at the eyes. He will look for any obvious abnormalities, and any minor infections, if present, will be treated by the pediatrician itself. If there is something else that needs the attention from an ophthalmologist, the child will be referred. After that, when should a child be examined? Most of the times, the parents will start taking care of the children after birth till they join school. So it's the parents' responsibility to notice any obvious abnormalities. If they notice any squint is a deviation of the eyes, like if they're not looking straight. Some squints can be there till the age of around 6 months. Any obvious squint persisting after the age of 6 months, the child has to be brought to an ophthalmologist. Otherwise, if they notice anything abnormal, like seeing a white reflex in the eyes, any redness, watering, discharge, if they see that the size of the eyeballs are not equal, if they see that one eye is bigger than the other, they need to come back to an ophthalmologist immediately. Otherwise, if everything is normal, we recommend that the child's eyes be checked just before they enter school by the age of 3 to 5 years of age, whenever they are entering school.
Okay.
After that, the teachers will start looking at the children. So they will recognize if the child is not able to see something. And so after that, if there are no other abnormalities, maybe at the age of around 10 years of age, and as and when required, but compulsorily just before they enter the school, their eyes have to be checked, and as and when required.
So, doctor, we find that these days, at a very young age, children start getting glasses.
Yes.
So, a query that parents have is, should children be wearing their glasses all the time, those children who have glasses?
Yes. If you are asking me in general, say a child has been prescribed glasses, should the child wear glasses?
Yes.
Yes, they have to wear glasses all the time. There are specific cases, but very rare, so we will not get into that. But as a rule, if a child has been prescribed glasses, the child has to wear glasses all the time. What happens if the child does not wear? See, there is something called as lazy eye. We call it as amblyopia. People associate it with the term lazy eye. Basically, what happens when the child does not wear glasses, the image going to the brain from the eyeball is not of the correct quality. It's not very clear.
Yes.
So the brain starts ignoring those images. This is especially important when the power between the two eyes is unequal. So the brain will start considering the images which are clearer. So suppose the left eye is seeing better and the right eye is not seeing so well. The right eye becomes lazy. That means the brain is not taking these images coming from the right eye because they are not sharp.
Okay.
So what happens later on, say suppose the child is older than 10 or 11 years of age and the child has not been wearing glasses constantly. Even if we give glasses later on, the vision will not improve.
Okay.
So to avoid such complications, children have to wear glasses all the time.
Okay. So coming to adults,
Yes.
similar question, how often should adults check their eyes?
Right, again depends on whether they've been wearing glasses from before and whether there are other conditions. There are conditions like glaucoma which can begin in childhood. So those conditions require regular follow-up as advised by the doctor.
Yes.
And even those who wear glasses from childhood, at least once in a year they have to get their eyes checked.
Okay.
Suppose an adult has never worn glasses, he really has no eye problems. When should he start really getting his eyes checked regularly? I would say after the age of 35 or at least by 40, at least an annual eye examination is required. This is because there are some diseases, I told about glaucoma. What happens is there are no real symptoms till it is really late. So to recognize these silent diseases of the eye, it is important that they get their eyes checked by the age of 35 or 40 and then annually, or again as and when required. Suppose they have other systemic conditions like diabetes. There's something called as type 1 diabetes which can arise much earlier in life. It's not really age related, but because of insulin deficiency, diabetes can arise earlier in life. They need to get their eyes checked yearly, soon after knowing that they have diabetes and so on.
Okay. Doctor, can you elaborate on that? Diabetics patients, how they should take care of their eyes?
Right. As everybody probably knows, diabetes affects most of the structures in the body. It's basically a disease of the blood vessels, and blood vessels supply all the parts of the body and the nerves. So it basically affects all the structures in the body. Similarly, in the eyes, it affects every structure in the eyeball.
Okay.
What are we worried about? Whether those structures getting affected can cause vision loss. So yes, it can cause vision loss. That is why it is important for diabetic patients to get their eyes checked regularly. How it can cause vision loss? There is a layer in the eye called as retina, which is a layer basically which converts light signals into nerve signals and which are passed on to the brain.
Okay.
So retina is very vascular. It has a lot of blood vessels. So these blood vessels are where most of the changes happen in diabetes. We call the changes as diabetic retinopathy.
Okay.
Patients will not really realize again till it starts affecting their central vision. There can be a lot of changes going on in the periphery of the retina which can eventually come to the center.
Okay.
If it starts affecting the center of their eye, they'll realize immediately and go to a doctor. All this it happens when their central vision is affected. We do not want them to come to us only when their vision is affected. So any diabetic patient, as soon as they know that they have diabetes, they have to go to an ophthalmologist, and after that, even if there are no symptoms, even if the retina was normal at the previous examination, they have to get their eyes checked once in a year at least. And if there are changes, that we will recommend how often they have to come. What care they can take to prevent vision loss when they are diabetics, as recommended by any doctor, keep the sugars under control as much as possible and get the eyes checked regularly. It's the diabetic changes are reversible when the diabetic sugar levels are under control, and if we notice any changes, we can advise the patient accordingly. If there is some leaking blood vessel in the retina, it can be lasered. So it will prevent further complications.
Okay.
So this is how diabetics can take care of their eyes.
Definitely, that's a very important advice for the diabetic patients. Doctor, as we know, after the COVID pandemic has started, most of the things have come to the online mode.
Yes.
And screen time for everybody has increased, drastically after the pandemic has started. So what would be your advice? How can we protect our eyes from straining due to this excessive screen time?
Right. So the very obvious first advice I would give is avoid unnecessary screen time.
True, true.
Children, they're already used to sitting in front of the computers or their mobiles and tablets for the online classes.
Yes.
What they do is they continue to use these screens even after the classes are done for playing games or watching movies or anything.
True.
I would say limit that, limit unnecessary screen time as much as possible. And when they're looking at the screen itself, this applies to even adults.
Yes.
They have to blink regularly. Remind yourself to blink.
Okay.
Our blink rate reduces when we are looking at some screen. So that can cause dryness and all that, and it will cause strain in the eye.
Okay.
Also, every 20 minutes, look at something far away, preferably 20 feet away, at least for 20 seconds. This they can do even when they are attending the class.
Okay.
They just need, if there is a window next to the place where they sit, they just need to look outside, at least for 20 seconds.
Okay.
That gives a break to the muscles inside the eye.
Okay.
So that will prevent strain in the eyes. Other than that, for adults, we also prescribe lubricants if their work involves sitting in front of a computer screen. That will help a little. So this will minimize the amount of strain caused to the eye because of increased screen time.
Thank you, doctor. That was definitely an advice for all of us, which we should take note. We have further questions to ask the doctor regarding certain eye problems and how we can prevent it, how we can cure it. But we will be back after a very short break. Stay tuned. Welcome back. You're watching Kim's Health Doctor Live. Joining with us in today's episode is Dr. Rajiv. So we shall continue with further queries. Doctor, in the first part, you had mentioned about glaucoma.
Yes.
So what is it exactly and how is it preventable? Can you elaborate?
Right. First thing, glaucoma cannot be prevented really,
Okay.
but I'll come to that later.
Yes.
What is glaucoma?
Okay.
Glaucoma is a condition which affects the nerve in the eyeball.
Okay.
There's a nerve which carries these visual signals, I said. The retina converts light signals into nerve impulses.
Okay.
There is a nerve which takes these nerve impulses onto the brain.
Okay.
The beginning of that visual pathway is through the optic nerve.
Okay.
So, a part of it, the very beginning of the optic nerve, we can see inside the eye.
Okay.
That has a certain structure to it. In glaucoma, the structure is altered, and then this can be associated with a raised pressure inside the eye. We call it as intraocular pressure. It is not necessary, but in most glaucoma cases, the pressure is also increased.
Okay.
What can all this lead to? Normally, when we look straight ahead also, we can see a little on the sides. In glaucoma, this field of vision goes on getting constricted.
Okay.
So, this is how we identify glaucoma, by these three factors which I mentioned. We see changes in the optic nerve.
Okay.
We see that the pressure can be raised. Again, I stress that it can be normal and patient can still have glaucoma. And the final confirmation is we see the visual field getting constricted. Another important thing to call it glaucoma is all these changes are progressive. That means if we observe them over a period of time, say 6 months or 1 year, these changes are progressing.
Okay.
So, that's another important factor. So, this is glaucoma in brief.
Okay.
Can it be prevented? Depends on what was the cause of the glaucoma, if there was a cause.
Okay.
Most of the times we call it as primary glaucoma. That means there is no underlying factor as such which can be recognized, especially in open angle glaucomas that we define based on the structure of the eyeball.
Okay.
So, without any real cause, the patient develops glaucoma. There can be raised pressure and we see these optic disc changes and field changes.
Okay.
You search for a cause, there is no real cause. So, this type of primary glaucomas cannot really be prevented. On the other hand, there are certain medications, say steroids. Steroids are used as medications for many things in the human body.
Okay.
One of the side effects of glaucoma, of steroids, is glaucoma.
Okay.
So, can we prevent glaucoma? Yes, by preventing the use of unnecessary steroids.
Okay.
So, that probably is the only way we can prevent glaucoma. Other than that, we have to recognize glaucoma early and treat it. How do we treat? We can't reverse the changes that have happened in the optic nerve. It's part of the central nervous system. So, the changes are not reversible.
Okay.
We have to arrest the damage at least wherever it has happened.
Okay.
We can't really reverse the changes. So, yeah, early recognition and treatment. Treatment in the form, we usually aim to reduce the pressure inside the eye, and this kind of arrests the progression of glaucoma. So, that is the treatment of glaucoma.
Okay.
So, it can't really be prevented if it's going to happen. Suppose the patient has I told based on the structure of the eyeball we can define glaucoma. There's something called as angle closure glaucoma.
Okay.
Basically, the eyeball is smaller than normal, to put it in very simple terms.
Okay.
Such patients are predisposed to developing something called as angle closure glaucoma. There again, if we anticipate, especially if the patient has a family history, or if the other eye had similar condition and that has gone in for glaucomatous changes,
Okay.
we can do something as a laser in the iris of that eye to prevent that high rise in pressure.
Okay.
So, that again is kind of prevention, but it actually is part of treatment of glaucoma.
Okay.
So, this is how we can prevent and treat glaucoma.
Okay. So, doctor, for the early recognition of glaucoma,
Yes.
what should one person?
Exactly, like if you remember, I just now mentioned that adults, especially after the age of 35 or at least by 40, have to get their eyes examined regularly.
Yes. Okay.
This is one of the reasons to recognize glaucoma early. when it is recognized, you can take steps to arrest the progression and treat it. And like I said, in angle closure glaucoma, by doing some lasers,
Okay.
that rise in pressure can be prevented. So yes, this is why a regular examination of the eyes is important. For the patient to know that he has glaucoma, it will take a long time.
Okay.
The visual field changes have to be like at end stage for him to notice that he can't see anything on the sides.
Okay.
So that's how we treat and recognize glaucoma.
Okay. Doctor, another eye problem that we have heard of is cataract.
Yes.
So, what exactly is cataract and how is the treatment of cataract done?
Right. Cataract is basically an opacification of the lens. There is a lens which is already present in the eyeball.
Okay.
It's a natural lens.
Okay.
Normally it is translucent, at least we can call, not exactly transparent, at least translucent. It allows most of the light rays to pass on to the retina.
Okay.
As we age or because of other factors,
Okay.
it starts becoming opacified. When it reaches a certain extent where the patient's vision is not really going to improve even if you give glasses,
Okay.
so that's when the cataract requires treatment. Treatment of cataract is basically surgery.
Okay.
What we aim to do is remove the cataract as part of the lens and put an artificial lens in that place where the original lens was present.
Okay.
So it can't really be treated by other ways. The research was going on regarding certain medications which can reverse these changes, but no, at least in humans it's not yet available. So surgery is the treatment.
Okay. With surgery, we can completely cure
Yes,
cataract.
yes, cataract that way is curable.
Okay.
Yes,
So, when should we doubt whether cataract?
right.
When should we approach a
So,
doctor?
say a patient, a middle-aged patient or even an old patient after the age of 55 to 60, he's been wearing glasses, his vision was say constant, normal for some time.
Okay.
He starts noticing, he or she starts noticing that they're not able to see so well with the present glasses. They might not go to a doctor immediately, they might go to an optician.
Yes.
An optician also will be able to recognize actually when they look at the eye. So with glasses also, initial stages of cataract might improve with glasses. Suppose it's not improving,
Okay.
the optician, if he or she is seeing for the first time, will refer to doctors.
Okay.
So that's how you suspect that you might have a cataract.
Okay.
There is no no particular sign to say that this is cataract. That's only when we examine
Okay.
that we can notice that the lens is opacified.
Doctor, another doubt is what should a person do when a foreign body enters the eye?
Right. First thing I would say, don't start rubbing the eye.
Rubbing
It will definitely cause a lot more complications.
Okay.
What can you do at home? Suppose the doctor is very far away and you notice that some dust particle entered the eye. This also is not actually advised, but I would say just try splashing water. If it doesn't come out, don't do anything further. Just come to the doctor. Even if the doctor is far away, please come to the doctor.
Yes.
Don't do anything more than splashing the eyes with water.
Okay.
It is important that the foreign body is removed using the appropriate measures. Otherwise, it can lead to further complications. It can cause infections also in many cases.
Okay. Similarly, if some chemical substance enters the eye, what could be the?
Yes, chemicals, this is a little more tricky. Again, it depends on how far away the patient is from the doctor or from any initial first aid setup at least.
Okay.
As soon as some chemical falls into the eye, try to clean the eyes with whatever, the cleanest water that you have.
Okay.
What we do in hospitals is use the sterile normal saline or ringer lactate solutions to wash. Basically, we are diluting the chemical.
Okay.
What can you do at home if you're, say, maybe 50 kilometers away from a doctor? Use as clean water as you have.
Okay.
Tap water, again, as a doctor, I shouldn't really be advising it, but if you have no other option, the only clean water that you can find is tap water. It is important that that chemical be diluted as soon as possible.
Okay.
That is the aim of giving a wash in chemical injuries.
Okay.
So dilute as much as possible. Say you don't have IV lines and all that to wash, You will have glasses at least.
Yes.
So fill the glass with water and just keep pouring. Dilute as much as possible. And then come to a doctor. Don't do anything more. Don't try to neutralize whatever chemical has fallen by your methods and all that. Don't try anything.
Okay. Doctor, similarly, if something hits on the eye and the sudden irritation caused to the eye, what could be some things that we can do to?
If something hits, you mean some blunt object like a ball?
Yes, some objects as
Right.
such.
So again, you can't really do anything at home there. We need to recognize what structures are injured, if any,
Okay.
and then we only have to initiate treatment. It's difficult for a patient to know what has happened.
That is there.
Even a corneal abrasion, like some patients might see in the mirror, they might notice there's some redness.
Okay.
They will not really be able to see that there is a scratch on the cornea and all that. Even we sometimes have a doubt. We stain and see and all that.
Okay.
So any injuries like something hitting the eye and all, just don't do anything. Come to the doctor. Don't try to.
So even visibly, if there is nothing seen, but still if there's an irritation, you would advise
Yes,
them to.
come to the doctor.
Okay.
Don't try to think that it will go away and all that, because there is something called as intraocular inflammation.
Okay.
It might take some time for it to show up as redness and pain and all that. So even the earliest sign, come to the doctor.
Okay. Another common problem that people face is eye allergies.
Yes.
So how should we treat or how should we handle that?
First thing I would say is never to self-medicate. I've seen that many patients go to the pharmacies and buy some steroid eye drops.
Okay.
I already told you one of the common side effects of steroid, glaucoma.
True.
Cataract is another side effect of steroids.
Okay.
So yeah, avoid using steroids. It's bad for the eye in the long run.
Okay.
We do prescribe steroids when there is severe inflammation, severe allergies.
Okay.
So there, when we prescribe, we usually say use it for 1 week, or if we are giving it for more than 1 week, we ask them to taper.
Okay.
So that's how they have to use and stop as we have advised. Any patients feel they're getting better with steroids, so they keep purchasing steroid eye drops and using it. Don't do that. There's something called a seasonal allergy. Every summer or every spring in the appropriate countries, patients get allergies.
Okay.
That time they can use olopatadine, but again, that also will usually be first advised by a doctor. When we have advised that, and we would have told them, you can buy this and use when you have allergies.
Yes.
Only then they can do that, and never for steroids.
Okay.
Steroids they should not buy and use by themselves.
Okay.
Yeah. And avoid rubbing the eyes. Rubbing the eyes will definitely worsen the symptoms.
Okay.
It will become a vicious cycle. Rubbing the eyes will increase itching. So patient will keep rubbing more. It will cause increased itching.
True. What could be some causes of eye allergies?
Right.
Is there any preventable causes?
Yes, some patients they'll know that when they go to a certain area, their eyes start itching.
Okay.
That could be because of pollen grains from that place, something in the air from the plants or trees present there. So avoid those areas. Most people are just allergic to dust and stuff. That's like that will be there throughout the year. You can't really prevent that.
Yes.
And seasonal allergies, like I said, again because of plants and all that. So certain plants bloom in certain times of the year, hay fever and all that. Eye allergies can be associated with that. If possible, avoid those places or whatever object you know causes allergy to you. Other than that, you can't really prevent it. You will have to treat it. It is important to recognize that allergies can't be cured once and for all. It's not like fever. Yeah, I give you some medicines and it gets cured. It's not like that. Allergies, on the other hand, it's your body reacting to some outside allergen.
Yes.
So whenever the reaction flares up, we bring it down by giving medicines.
Yes. Okay. Doctor, similarly, dryness of the eyes is something that irritates people. How can we handle that? How can we treat it?
Right. Again, dryness these days at least is mostly caused by increased screen time.
Screen time.
There I already told that we have to blink regularly and take breaks every 20 minutes or so.
Okay.
And we also give lubricant eye drops.
Okay.
What else can be done to prevent dryness in particular? Say some people who are working in offices, in front of the screen all the time. The AC vents are directed right at the face. If possible, direct the AC vent away from the face,
Okay.
or you change your direction so that it's not blowing right on your face.
Okay.
Basically, it is causing increased evaporation.
Yes.
So that's going to cause a lot of dryness. What else can be done? Just avoid unnecessary screen time, like I already said.
True.
And use lubricants. Again, that initially at least doctors will prescribe lubricants. Do not. Some patients will not know what lubricants are, so do not self-medicate again there. So better that a doctor has told you that this is a lubricant, and then the patient can use.
Doctor, eye conditions, generally people tend to self-medicate. So how would you say, is there any eye conditions that people can self-medicate without any harm?
Right, like I said, seasonal allergies or allergies that are perennial, means throughout the year. I told some drugs we tell you can buy if this gets over and you can use.
Yes.
Those drugs they can self-medicate, provided the doctor has told use this, and we would have given the first prescription to them.
Okay.
Again, I repeat, definitely not steroids. Some patients may not understand our advice correctly. They may think we can use the steroid also however we want. No, don't use steroids.
Okay.
Other conditions where self-medication, again lubricants, like I said, for dryness,
Okay.
still make sure that it is a lubricant and use it.
Okay.
I wouldn't advise self-medication for anything else. Better come to the doctor, because it is difficult for a patient to recognize what the condition is, other than allergies and dryness of the eye and all that.
Doctor, finally, we can come to the end, towards the end of this episode. Would you like to sum up everything that you said till now, how to care for the eyes properly?
Sure. Yeah. So what anybody needs to do, if you have some eye condition, avoid self-medication.
Yes.
Come to the doctor as soon as possible. Chemical injuries and foreign bodies are very important. I would like to stress on that. They're something we call as medical emergencies.
Yes.
The chemical injuries especially.
Okay.
If some soap-like chemical falls into the eye, there is a good chance that the patient can lose the vision also.
Okay.
So if you're very far away from the doctor, wash your eyes with the cleanest water that you can find and rush to the doctor. Do not try anything else.
Okay.
When foreign bodies fall, don't try to remove by yourself. Maximum you can do is splash some water. If it's not coming out, come to the doctor.
Okay.
And I would like you all to follow the advice I've given to prevent eye strain because of increased screen time.
Yes.
That's about it. Other conditions like glaucoma and cataract usually have to be treated by a doctor. Cataract especially requires surgery.
Okay.
Glaucoma, it is important to identify early.
Okay.
So regular eye checkups, as I have advised, is important.
Okay. Thank you very much, Doctor, for joining with us today and for answering all our queries.
It was my pleasure. Thank you.
Thank you, Doctor. So with that, we come towards the end of today's episode. We shall be back again next week. Until then, this is Marina Francis signing off. Stay healthy, stay happy. Good night.
The 16th branch